So thank you all for coming again this morning, quite early, I guess. My time, it's 4 a.m., I think, something like that. So I'll try to be coherent. And I wanted to just start out by saying kind of a little bit about my background so you can understand why it is that I'm talking about these areas today. I've kind of been a human interface between research and practice, and I've spent my whole entire career really working on the one hand on randomized controlled trials from a university perch, as well as working within communities. And so I'll try to bring in some of those experiences today. For example, I worked actually when I knew Gary Slutkin back at University of Illinois at Chicago, where I was doing a large randomized controlled trial of a school-based intervention in 19 Chicago schools and in some suburban schools, and it was an 8-year National Institute of Health funded project. I also worked more recently in 2 randomized controlled trials of family interventions with immigrant Latino families in the U.S. and Southern California. And I'm going to use that as an example of how even within the U.S. there's a lot of variation, and even within Latino families there's a lot of variation in sort of the applicability and the generalizability of some of the programs that we do. And then most recently I've been involved in a randomized controlled trial of the National Youth Orchestra of Venezuela, which has actually been an amazing kind of collaboration with IDB and folks on the ground and people from different universities. And we did an RCT of about 3,500 children with a 1-year waitlist control with in-home assessments, individual assessments, using interactive games, using paper and pencil measures, using parent ratings. So it's really a great study. And so that's kind of the one half of what I do. On the other half, I've been working with communities in the U.S. for many years and in Latin America and the Caribbean. And I was interested in Manuel's reference to Honduras because I worked in Honduras with World Bank for quite a while. And it was the probably most kind of dramatic experience for me of just saying, I don't know what to do anymore. It was just so difficult because of so many issues that were going on there. And I'll bring that in as an example because I think we have to deal with that. And also in Peru, and I'm going to talk more specifically about an example from Peru. Let me just preface what I'm saying, because I really do think Manuel asked us to consider big picture and where we need to go. And of course, I see it through my own lens because I spent my career bridging research and practice, but I think I challenge all of you to really think carefully about how we think about the end use of our research and how we really let practice inform research and we let research inform practice. And I'll just tell one other story because at the end of the day, we all remember stories, right? Which is the challenge of evidence-based, spreading evidence-based findings because everybody remembers a story. National Institute of Health in the U.S. convened a panel of researchers and practitioners who were working on interventions for children and youth. And I was on a panel that looked at the developmental considerations, child developmental considerations of interventions. And the panel was Rolf Lober, who's a well-known criminologist, who was talking about etiology, myself talking about intervention programs, and then a man who is the vice president of Boys Club and Girls Club of America, which is a big NGO. And we were asked, how do we think about development in our studies, child development? And Rolf said, we look at trajectories of risk factors and different risk factors over time, etc. And I said, we try to develop sensitive interventions that are responsive to different age groups, etc. And the vice president of Boys Club and Girls Club of America said, we serve whoever walks in the door. So that always stuck with me because it's such a kind of poignant example of the different worlds that we live in. They don't have the luxury of thinking all these things through. So I'm going to talk about that a little bit today. And let me just I'm going to try to make it really simple. One thing I've learned in trying to translate between research and practice is just to try to really simplify what we do. Because as we all know, violence is complicated. Prevention and intervention is complicated, and how can we make this a bit easier to digest and understand and really, again, think about the end use. So I'm going to talk a little bit just about programs and practices. And then I'm going to talk about where I think the field needs to go in terms of really building an evidence-based research continuum. And I'm going to give an example of, I think it was a fantastic way to manage this in Peru. And it was something that, I just was brought in later. It wasn't my idea, so I can tout its strengths. And then I want to talk about where do we want to go? How can we move the field? And let me say, I think the field, just in my tenure here working in this area, there's been amazing progress. I mean, the whole concept of evidence, I think, is really something that we should give ourselves credit for, that we've created an evidence culture where people appreciate the value of evidence. I'm not quite sure we know what that is or how to evaluate it yet, or certainly not in the field, but at least we understand that evidence is important, that you can't just make up something and, someone said it was good. So I want to talk about, given all these advances, where can we go next? Where do we need to go? So let me just start, and for some of you, and most of you, this is probably old news, but I just think it's important to quickly highlight some of these issues. And there's this really kind of debate in the field of programs and practices, and we've made a lot of advances with lots of programs out there, and these are all the ways that we define them. And clearly the idea is that they're evaluated with rigor under relatively ideal conditions, and we often have these lists, and we all know blueprints and lots of different lists, and I'll talk a little bit about that. Just to kind of summarize some of their strengths, and let me again kind of provide a context that I think it's really been an advance that we've done, RCTs and sophisticated evaluations of evidence-based programs. Again, they have strength of the evaluation, there's training, there's guidelines, there's materials, you can find them, you can locate them. But I think we also have to realize that they have a lot of limitations in the real world. And, this one-size-fits-all, do it exactly as I did it or it won't work, is really not sensitive to context and culture. And I'll just give you an example, and not scalable. I don't know, I know there's some economists in the room, but psychologists typically don't think about cost or, feasibility or anything like that, which is almost unconscionable because in the real world, there's limited money to implement these things. For example, with immigrant Latino families, we did a randomized controlled trial of Families in Schools Together program. Many of you have heard about it. It's on lots of lists of best practices. And it had even been shown effective with Latino families in, I think, Wisconsin. So we thought, well, this is a good program. Parent-child interaction was kind of the foundation. It really fits the needs of the community. They liked it. So we did this. We had CDC funding, Center for Disease Control. We did a big RCT. And at the end of the day, we saw no difference on child aggression. We saw no difference on parenting. And this was a 4-year study with a lot of families, cost a lot of money to do. And then we did follow-up focus groups, because I always try to do, in any intervention, I think we need to understand more about the processes, how it worked. And so what we found is that the parents really liked it. They thought it was cool. They liked playing with doing the parent-child interaction activities. But they said, but it doesn't help us with the challenges that we face here in Southern California. The challenges being most of them were undocumented and most of them didn't speak English. And they said, we need to know what to do when my 5-year-old who speaks English says to me in Spanish, if you call Child Protective Services, if you punish me for doing this, I'm going to call Child Protective Services and report you for child abuse. I was like, that's not in the manual. We didn't see it there. We don't know what to do with it. And they didn't know how to deal with the systems. They said, we feel very marginalized. We don't know how to advocate for our children in the school system here in the U.S. We don't know how it works. We're afraid to speak up. And because there was such a huge press on immigration raids happening all over, they were even afraid to go out to come to our intervention. So how do you consider that? And so when we learned that, we actually developed our own hybrid home visitation model because we could come to them. We had lay community workers who they trusted, who understood their needs. And we did an RCT with that, and it was much more effective. And so it wasn't really a program, and it was a good example of some of the limitations. The last one I want to say, I could get on the soapbox for too long, so I won't. A lot of these evaluations, there's a financial vested interest in them. And if you really want to be critical, you have to, look at evaluations not conducted by developers of programs. Programs are expensive, and when they have to be implemented exactly as developed and be trained by people who are part of this agency, it's also a challenge. So I think we just need to consider that in terms of there's a value to them, but it's also conditional in a lot of ways. If we shift to evidence-based practices, which are really more guidelines, looking at risk and protective factors, looking at theories and meta-analysis, and trying to integrate research evidence with the local context, I think it moves us in a little more reasonable direction. And, it's interesting because in the healthcare field, evidence-based practice is basically the model that's used. And in public health, to some level, this idea that the best available research evidence is just one piece of your decision making, which means that you don't just take program A and do it. You look at the context, you look at your expertise, you look at the needs and the values. And so in the case of our program with immigrant Latino families, very different organizational context. And by the way, FAFSA was just too expensive. The agency we worked with, an NGO, Latino Health Access, is we don't have this kind of money to run a program. You need a facility, you need childcare. So we really try to understand it in the context. And again, just with programs, there's strengths and limitations. And so the adaptation is a big strength. How do we get this confluence of evidence to bring it together, matching the cost, and engaging participants and providers? It's another interesting thing. On the one hand, we have this rigid, follow my program exactly as it is. On the other hand, we have a lot of interest in community participatory research and community participatory action. Yet they're kind of orthogonal. If you say, do my program as it is, I'm saying, I don't care about what you think. It doesn't matter, just follow it. So we're not allowing people to kind of put their own stamp on it. And if we say, and it may be in some cases it fits perfectly, so it's fine. On the other hand, if we just have all community participatory programming, we're really not taking advantage of research evidence and of anything sort of a scientific basis for what's done. So you really have to think about how can we engage people in the programming. I've found, and I'm sure you all have too, that if you don't engage people in what you're doing, you just stamp on a program, it's just never going to work. People want ownership, they want buy-in, and that's part of the challenge. And again, there are limitations. It's easier to have a program. You have to develop a program. We don't have uniform guidelines for practices. I'm always struck by all of the reviews that we do are just reviews of programs. We don't really say what are the underlying principles. And so that's why I think the field should go. And, of course, you can't say with this new program, when we did that, we called it Child Development Parent Training, and the parents renamed it Madre a Madre, mother to mother, which was even an interesting kind of phenomenon. They said, we don't want to call it Child Development Parent Training. That's way too, big language. It just doesn't sound like we're mother to mother talking about our kids. And they helped us kind of adapt it. But we certainly couldn't say the first round, will this be effective? Because it's a new program and we were really cobbling together from different pieces. So with that in mind, the question is, can we marry the two? Can we build a continuum that allows us to take advantage of RCTs and experimental evaluations of programs, of etiological research, of qualitative studies where we understand some of the complexities of cultures, and how do we build a continuum? And that was it's a little blurry, but that was from the National Youth Orchestra of Venezuela. And if I had time, I'd play the video. It's the cutest thing. They start when they're babies now. And these were 2-year-olds, 2- and 3-year-olds, starting with little instruments, and they all are wearing their uniforms. It was very cute. But let's just think about it. And this is just really open for discussion. I was thinking, as I was preparing this talk, I thought, what would a continuum look like? And so this is just my random firing in my brain. Open for discussion, contribution. I hope to have other people's input and where do we go, but I think we need to start thinking about a continuum. And so if we look at kind of where we are and where we need to go, it's really a developmental progression. I'm a developmental psychologist, if you haven't guessed, of the development of interventions and our work globally and what we need to do. So we really have a fair amount of research on etiology. I mean, I'm an editor of Journal of Research on Adolescence, and I actually am getting to where I want to publish. Larry Steinberg already did this. We already know this. Don't send another study showing that parental monitoring is going to be associated with lower levels of antisocial behavior, or antisocial peers will influence delinquency. There's a lot that we know. We've done great etiological research, and I think etiological research is essentially the foundation of interventions, because these are the most important risk factors. These are things that are changeable that we know. We've done a lot of program evaluation, RCTs, and other evaluations, and I made this comment yesterday in my my small session, and I may have gotten misinterpreted, that we need to go beyond just RCTs, because there are lots of programs. USAID has every program evaluation on their website. The banks that do evaluations often don't publish them in journals, but they go through the most ridiculously difficult peer review process, more than any journal, in terms of just, the critique and the level. So there's a lot of information out there in terms of evaluations that haven't been published necessarily in a specific journal that we need to look at. And we're moving, but I think we're not doing a good job on looking at mediators and moderators. And to me, and now National Institute of Health in the U.S. has now come out with guidelines on translational research that you have to look at mediators and moderators. You have to look at the mechanism by which your intervention works. It's not a black box. Change in what seem to be most predictive of change in behavior. And moderators, it's almost unimaginable that we don't look at what works for whom. And, if you follow the research on health and illness, people are just discovering gender, that, wow, women's bodies are different than men's, and there may be different risk factors, and different interventions have different outcomes. And if you look at our research, some studies might look at gender differences, but not a lot if the intervention is equally effective. We tend to look at ethnicity just in a big what you checked, but not necessarily cultural practices for whom it works. Income level. In Chicago, it was interesting. We looked at moderators of the school-based interventions, and we found that they were relatively effective in moderate resource schools, but absolutely not effective in really low-income inner-city schools. And, when you think about it, we were doing a teacher training intervention, and one of our schools had no teachers for 4 months because they were so resource poor. They had a hall monitor who would go and give worksheets out. So, at some level, we need to consider these moderators. And that's when we talk about things like programs and efficacy trials. And I think we're pretty good there, but we need to do better. Moving to the next step, I think right here is where the field really needs to build right now, and I think it's fabulous that we have things like Campbell Collaboration and Cochrane Reviews. We don't have a lot just on violence. We have crime and justice. Some of it is linked to violence, but we don't have a lot in my area, violence in childhood. We don't have a lot of meta-analysis or systematic reviews, and of course you need program evaluations to have meta-analysis. But that will allow us to get a better understanding of what might be some strategies, what might be some principles and some components that we can say you can use. And this all takes us to this whole application area, which I think we need to think that through better also. How will my program be applied? Is it going to be even feasible? And I always tell people, why are we funding these really expensive programs? Because in most of the world, they're never going to happen. Even in the U.S., they're not going to happen. So we need to think about, is there an evidence-based program that might match? And I think if we require developers to say, kind of like a protocol like you have for the systematic reviews, here are all the contextual factors that are important in why this program worked: cultural beliefs, SES, etc., infrastructure. And then you can do the program exactly as it is. But we might have to do something new. We might have to adapt a program. And for me personally, I find that all the blueprints are really useful in my work as sort of general ideas and, this seems like a good kind of piece of the program. Let's put it together in a new one. I've never followed one exactly. I would never even want to do it in the context that I work in around the world. I mean, even in the U.S., I think it's, and I've heard people talk about this country versus that country, but there's a lot of within-country variation. There's a lot of within-city variation, as we saw in Chicago. And this is where we start thinking about practices and effectiveness and things like culture and context and cost. And then here's the real challenge, and from what I've been hearing, do I have like 10 minutes? Keep mindful of my time. This integration into systems, and Honduras is a good example. Really, nothing's going to be sustainable if it's not integrated into the system in a way that it takes root. And it has to be participatory to take root, but the system has to have some level of capacity. And I know that's a challenge. We were talking about it at breakfast. What level of capacity? So in Honduras, I was working with the World Bank there and a little bit with IDB, And we were talking about building a social emotional learning curriculum in schools. Now in Latin America, I think social emotional learning has kind of gone up on the radar. And, first we looked at some curriculum that were $2 million, which was never going to happen. But then we were thinking about the systems, and you have a school system where you have high schools with 10,000 students, controlled by gangs, where teachers I can sell you my teaching credential, I can sell my neighbor my teaching credential. Teachers don't show up for 5 years and they're on the rolls, So how do you ever think about something like that being embedded in a system? And I think at some level we have to realize that there are some systems that are just too broken to do what we want to do. We can't just say we like social emotional learning, we're going to bring it in. The system, and I think David mentioned this yesterday, the system is just not ready for this. And we learned in Chicago that, in some of our really distressed schools, they just, they needed other things. They were using money we were giving them to put doors on the bathrooms and buy toilet paper. And, maybe there's a developmental sequencing. I think Bernadette had the pyramid on of kind of basic needs. But, at some level, the systems, it won't be integrated into a system. And then kind of the bigger issue of how we understand the whole ecology that these problems happen in. And I think one of the things that I was always afraid of, and this sort of started when I was working in Chicago, is, these are ecologies and contexts that I wouldn't want my children to grow up in. Children have to we had to let kids go, and this was in Chicago in the U.S., in groups of 10 across the playground so that they wouldn't be a target for gunshots, and our project director got shot. She was okay, but these aren't conditions that you want to grow up in. So are we just teaching kids how to adapt to it? Some of you, I'm sure many of you know Ken Dodge and a lot of work that had been done on hostile bias, and that aggressive kids tend to attribute hostility, in ambiguous situations. And we used to get in a discussion. I say, in inner city Chicago, it's a good thing. If they didn't attribute, if you don't know what someone's motivation is, you better think they're out to get you. And how do we integrate that? That's not part of the programs that we were thinking of. And, you stop and think. And so we adapted it to say, your first kind of line of thinking is, am I in imminent danger? If you're in imminent danger, whatever you need to do, get out of danger. But often you're not in imminent danger. What happens is it gets overextended to everything is danger. But we had to modify it. So you think about how these fit in the system. So let me give you an example of kind of a whole city effort to use evidence-based practices, to bring in research, bring in practice, how we adapted this. And I have to say, working with the Peruvians, they're amazingly articulate around social emotional learning and the importance of it, and it's really become part of the vernacular. It's become really part of the dialogue. So we started with, a really good place to be, and this was a project where it was the Ministry of Education and the Ministry of Labor were both aligning. And if you look at all the non-cognitive, the heck with Heckman, did you say? All the non-cognitive skills, and I've heard Heckman call them social emotional skills. There's a high degree of overlap, self-regulation, empathy, etc., planfulness. And there was really momentum to kind of get this going. The Ministry of Education was partnering with the World Bank to develop a comprehensive K through high school program for students and teachers. And they wanted to implement it in all the public schools in Greater Lima. And everyone agreed that the idea was social emotional learning. So it was a really good sort of context to do this in. It wasn't a researcher coming in and saying, do this, or a consultant coming in and say, here's a program. So here's what we did. I'm going to take it through the steps. So first we said, well, what's the evidence base on programs? And we identified, if you look at blueprints, you see PATHS program, 5 minutes, okay, I'll talk fast. Second step. So we got into some discussions with second step. Many of you, I'm sure, familiar with it. It's not in Spanish. It's been tested with, some people who check Latino ethnicity. And they wanted about, I kid you not, about $3.5 million to translate it and train on it, and et cetera, et cetera. So that's not going to happen. No programs available. Then we looked at some meta-analysis. There's a good one in Child Development 2011 looking at, 85 or a number of programs. Well, social emotional learning seems to be really important, and here's the areas that we've identified. So self-regulation, empathy, problem solving. But we don't have a plan for you how to do it. Here's just a lot of areas that you might want to think about. because we had to realize in that context, and I went and did some piloting in one of the schools, something that even in the worst schools in Chicago never really kind of came up was the level of noise. You know, just noise can be a real problem when you're doing programs. The classrooms had half walls. So you'd have a row of 10 classrooms with half wall. You could hear the noise from everybody's classes. How can you really do an intervention and just take a kind of planned program? And we came to the conclusion, wow, you know, until we can build walls, which would be a better structural intervention, we need to incorporate mindfulness activity. So every lesson started with a kind of meditation and focus and even with some headphones to cut out the noise. And the kids would say the biggest stressor is noise. So how do you adapt it? You know, and we had not a lot of money. This was done on a dime. There wasn't a lot of money. And then how are we going to integrate it in the system so it'll continue when we leave, you know? And what we did, I'll go quickly. So we had a group of people. It was I was on by a video conference in the US and people in Peru, and we kind of looked at all of the principles of social emotional learning. Sorry I didn't translate this, but for some of you it's not a problem. And we came up with like, what are the ways that we can frame these? And they came up with these three kind of main areas with myself, with the rest of, with everyone else, and with my challenges, or they call it dimension of reality, literally. And then we looked at kind of 6 kind of mid areas of, again, aligned with the research, but not anyone's model, not, you know, the 5 C's or the 40 assets or anything. Self-awareness, self-regulation. I wanted to call it resilience. This was an interesting debate, but they said we don't like that word. We wanted to call it determination. So they called it determination, which was achievement, motivation, perseverance, stress management, social awareness, relationships with others, and decision making. And so, but the point was this was really a good blend of kind of a homegrown kind of stamp on what we already knew was the evidence. So it wasn't like they just made these up and said, they looked at lots of different models, we looked at the research, and we collectively came up with this. And then we thought about how we're going to integrate it in terms of the components. So there's actually a certificate in social emotional education. There are teams of itinerant teachers who are specialists in this that go around and provide training. There was a big focus on school climate. And then a toolbox for social emotional learning. So ways that this will continue on. And again, it's freely available, and the idea of World Bank and the ministry was to have it freely available in Spanish for everybody to use. And so, you know, another issue of having things in the public domain. So let me just wrap up. And it's been actually an amazing example of how we can do these things collaboratively, adhere to science, but also adapt to practice. So let's just think about how, I'm going to challenge all of you, how are we going to move the bar now to these more cohesive strategies supported by evidence for real-world implementation in different settings around the world? And just to summarize, I think some of the challenges are, as I've said, you know, how do the generalizability of most programs is pretty bad. You know, to say that it's an evidence-based practice because it has one trial and one replication, it's just almost silly. You know, it's fine in that condition, in that setting. I can say, yes, it's an evidence-based practice, but there's so much variation by cultures, and particularly if we're talking globally on how we want to do things. And so I think really that we need to focus on these synthesis and reviews that, and I was very impressed with the preventviolence.info and all these efforts that were kind of moving to catalog programs, but I still think, 1 minute, okay, I'll talk fast. I still think we need to go beyond even cataloging programs. We need to do much more qualitative follow-up. We need to do much more in looking at moderators when we're doing these reviews, and when does it work, and we need to do much more in terms of what doesn't work. I'll end with this. We tried to do a special issue. I had a CDC Center on Youth Violence Prevention on programs that didn't work. It was a special issue, American Journal of Evaluation. And we reached out to people. We want to do a thing on what doesn't work because you can't publish it. At the end of the day, people could not do it. We had to call it pitfalls and pratfalls, challenges of program evaluation. People could just not say, I'm going to let you know about my program that didn't work. So it was like, well, we tried really hard and we had some success, but this wasn't as good. And it was really enlightening that, you know, it's really hard. And there are a lot of evaluations of evidence-based programs that people do that they don't find significant effects on. And then what do you do with that? The state of Connecticut does multisystemic family therapy, which is probably one of the best evidence-based practices. I got a frantic call from my colleague there once. We just spent $5 million on MST, and they're very good at evaluation. We did a 3-year evaluation, and it's no better than just our regular homegrown program. What do I tell the Board of Supervisors? You know, and that never gets published. And I said, well, tell them it's no worse. Anyhow, and let me just end, and I don't have time to, I'm part of this no violence initiative that I know, really, I just was brought on again. I'm lucky I get brought on after the fact. It wasn't my idea or my initiative, but I know Alex and a number of you have been involved in this, and Susan, and I think it's a great opportunity. I want to just let you know, if you're interested in being involved in some way, email me. We're really trying to move the field to looking at these practices and synthesis and directions that understand implementation and context, and we're going to do case studies. Okay, I'm done. Case studies and advocacy, and so if you're interested at all, please let me know. And this was one of my grad students working with a program in India, so thank you.